Now, if a parent is starting to suspect that their child could have asthma, what are the signs that they should be on the lookout for?
Yeah, so in children, coughing and wheezing are the most common symptoms. So, that could be a cough that just happens every time in the spring they notice it, or it could be a cough that's happening just at nighttime. It could be a cough in response to certain exposures like cold air or exercise. And then in general, if you have a patient that's got a cough that's lasting more than 3 weeks, that's something that you should think about too. You can also have just being short of breath or chest tightness or pressure. Those are some other signs, but the coughing and the wheezing are the most common.
And is it that they happen in some kind of pattern or?
As far as the coughing, I mean, the pattern you're going to see is when the coughing occurs. So is it a nighttime cough? Is it a seasonal cough? Things like that. Just any kind of persistent cough is going to trigger, the diagnosis of asthma.
So if perhaps parents are starting to see a lot of coughing, maybe
Mm-hmm.
at nighttime, um, are there things that they can do to get the most out of their first visit to a pediatrician?
Yeah, I mean, I think when you have a child coughing, I think one of the first things, you may take them in and they may get diagnosed with an upper respiratory infection or something like that. And you can have a cough that persists after that. But if it's something where it's repeated and persistent and, just not getting better, I definitely bring that up. Because there are certain things you can try. Sometimes with kids, it's very hard to do any kind of testing because they're so young, and
Mm-hmm.
we can't really rely on those tests. But, doing a trial of asthma medications, inhalers, and things like that is certainly reasonable if you're really suspecting asthma.